Welcome to the video. Today we are going to discuss an important and common clinical lesion, that is Hirschsprung's disease. Hirschsprung's disease is also called as congenital aganglionesis or congenital aganglionic megacolon. So please remember this name, congenital aganglionic megacolon. There is absence of enteric ganglion cells in both submucosal and myenteric plexus. Both are absent. So ganglion cells should be absent in both the places, submucosal plexus as well as the myenteric plexus. Both the places it should be absent. It is more commonly seen in the distal rectum. The most common site that is involved is distal rectum. Sometimes it can involve a variable portion of the proximal intestine as well. Sigmoid, colon, and rectum are commonly involved regions. It is commonly seen in male child, and it's seen in approximately 1:5,000 live births. There is a RET proto-oncogene mutation that could be coding or non-coding type of mutation, sporadic in many of the majority of the cases, and occasionally it may be associated with Down syndrome or sometimes other associated abnormality like intestinal atresia, malrotation, anorectal malformation that could also be noted in the patients of Hirschsprung's disease. What are the symptoms that we ought to know? What could be the typical clinical features? The typical clinical feature is neonatal failure to pass meconium. That is the most classical clinical feature by which it can be easily recognized. And sometimes it will not be there, and it will present with alternating signs of obstructions, constipation with diarrhea that can be seen in the older children. It may manifest later on. It may not manifest immediately after the birth. There may be signs of acute intestinal obstruction, enterocolitis with fluid and electrolyte imbalance. Rectal examination will show no stool on for rectal examination. So how does it happen? There is the normal migration of neural crest cells, that is from cecum to rectum, is arrested. So there is either arrest of the migration, that is prematurely, or the ganglion cells undergo premature death. There is a lack of ganglion cells, as we had discussed, in both mesenal and Orbeck plexus. There is a loss of intrinsic inhibitory innervation, that is the inhibitory substance that is secreted from the ganglion is not secreted. So there is a kind of inappropriate peristalsis. Continuous contraction is seen that leads to functional obstruction. Dilatation is seen proximal to the affected segment. That is the characteristic feature. There is a contracted segment, and the contracted segment proximal to that, there will be dilatation of the segment that is proximal to the affected segment. So affected segment is quite contracted, and proximal to that is dilated segment, and that is what it is called as Megakolon. So all the feces will be impacted over there, and the affected segment will be devoid of anything intestinal content because of the continuous contraction. It will not allow the contents of intestine, the fecal content, to pass through. As you can see in here, the normal image here, these are the ganglion cells. This is how they should look like. More of histocytic like feature, and there is abundant cytoplasm and a prominent nuclei are there. This is ganglion cell. Whereas in this case here, you can see there is lack of ganglion cell, and there is some hypertrophy of the nerve fibers that is being noted over here. And for further delineation and further diagnosis, we can do an immunohistochemistry for acetylcholinesterase, where here you can see these are the ganglion cells that is positive for acetylcholinesterase, whereas here the affected segment is showing lack of acetylcholinesterase. So this is lack of acetylcholinesterase in the affected segment of the rectum. That is the diagnostic feature of Hirschsprung's disease. So this is the schematic pic of how this happened. It's a normal sigmoid colon and rectum, and here you can see the megacolon, and there is a contracted segment due to absence of ganglion cell. And this is a further illustration where you are seeing the close view of proximal dilated portion, and a constricted portion is seen over here. Complications: enterocolitis of the dilated bowel, danger of perforation, that is the most significant complication, it can lead to perforation peritonitis and can lead to sepsis. Diagnosis is by rectal biopsy of the narrow segment. Treatment involves the excision of the segment of the colon that is deficient in ganglion cell, or the contracted segment needs to be excised. Now let's have a quick recap of our learnings. Lack of ganglion cells in the submucosal and myenteric plexus in the distal rectum and proximal intestine is what constitutes the Hirschsprung's disease. Failure to pass meconium in the neonates, this is the most classical feature, and constipation may be seen in the older child. Absence of the ganglion cells, lack of acetylcholinesterase, immunohistochemical staining in the biopsy, these are the cardinal features for the diagnosis. Excision of the disease segment with anastomosis of the proximal and distal segment, that is being done. So thank you for watching the video. Please subscribe to the channel, hit the bell icon and follow in our different groups, and please stay tuned for the next video. See you in the next video. Thank you.